point that if you are honest enough and can tell the patient, I don't know, but I can find out. And part of the problem is doctors are very reluctant to do that for two reasons. You don't want to let the patient know that you're clueless about what's going on because you're scared that if the patient gets the perception that you don't know, that he'll move on to the next doctor. And which is why the general reflex these days seem to be that you order a panel of tests, and therefore we end up treating the tests more than the patient. Dr. Sunil Pandya, isn't that true that that's one of the reasons why a lot of patients feel that medicine has become very commercialized? That people are just interested in looking at reports rather than talking to the patient?
I think this perception that medicine has become commercialized is based on a number of observations that the public makes about the medical profession. As Dr. Udwadia told us right at the start, and as you also emphasized, the respect which the medical profession was held in when your parents were practicing or when Dr. Udwadia started practice has dwindled considerably. And today the first attitude that you perceive in a patient is one of suspicion. Is this doctor out to fleece me? Is this doctor out to extract the last naya paisa from my pocket? This is the almost instinctive initial suspicion of the patient and the family when they come to you. And it is very sad that it should be so. There are doctors who fleece patients, but they are in a relative minority. And it's sad that this has been extrapolated to cover the entire medical profession. This attitude of suspicion is not without basis. There is a very genuine basis. I think it's common knowledge amongst the lay people also that laboratories, imaging centers, even one doctor to another doctor is willing to share fees, is willing to, what we call splitting fees is actually nothing but bribery and corruption. And the public at large is aware that this is happening. And so when a doctor orders 10 tests, they immediately start calculating per test how much must he be getting. And I think as Dr. Udwadia and Dr. Amdekar pointed out, if you have done if you have taken a good clinical history, and if you have examined the patient well, in many cases there is no need for any test at all. Where there is a need, you will explain to the patient that there are these three possibilities. I need to now determine which of these three possibilities is applicable in your patient, and therefore I need to do these tests. I think if this kind of explanation is offered and the rationale for each test is explained, then to some extent it will allay the suspicion that the patient came to you right from the start.
Dr. Thatte, you've been responsible for doing so much clinical research, but I think part of the way the entire clinical research is looked at in India especially is that a lot of people feel that poor people are being treated as guinea pigs or that they're not being looked after